I'm calling this meeting, good evening, this meeting of the Cleveland Heights City Council Committee of the Whole. And we have one item on our agenda today, and that's a confirmation hearing for the mayor's pick for Human Resources Director. So I'm going to let you take it away if you want. Take a short introduction, and then Ms. Weber, if you would just do a real short introduction, because we
Madam Vice President, we got to do roll call.
Oh, sorry.
Cobb.
Here.
Larson.
Here.
Posh. DeWitt Foy.
Here.
Cohen.
Here.
Huda.
Here.
Thank you for keeping me honest, Clerk Ballister. Appreciate it.
Thank you, Vice President Larson, and thank you, President Kuda, for agreeing to schedule today's hearing. I am pleased to nominate Dee Weber to become our next Director of HR. As what residents may remember, when they passed the recent charter changes, that created a Department of Human Resources here at the City of Cleveland Heights. And as you saw from Dee's resume, she is eminently qualified for that position. I am so grateful that she accepted my offer, and I look forward to taking questions from you all.
Ms. Weber?
Thank you. Thank you, everybody, and thank you for this opportunity to give you a brief overview of my background. Perhaps to sum it all up, I'm a cycle breaker. And what I mean by that is I was born and raised in the Middle East, come from very humble beginnings. My family migrated when I was a little girl. Grew up in I grew up in Detroit, and we moved to Toledo, where I spent the rest of my life. Went to the University of Toledo for both my graduate and undergraduate degrees. Had to pretty much prove myself throughout my career, simply because in my ethnicity, women are not viewed as being capable of getting to that next level. And that essentially became my mission, to make sure that I'm breaking that cycle. Began my career at McDonald's Corporation. Did that because they had a great tuition reimbursement program. Great experience, had an opportunity to work with both company-owned restaurants as well as franchised restaurants. A great culture that teaches you to be efficient, gives you self-confidence, and it teaches you the value of having integrity and a sense of urgency. From that, I have had the opportunity to work in healthcare for several years. In my career, I have progressed through the ranks, so I have been an HR assistant, a payroll clerk, a benefits specialist, a manager, director, and finally a vice president. I've been married for 38 years, and in fact, this evening we're celebrating our 38th wedding anniversary, which is why I wore the green, because I have a jacket on top of it. We raised our kids in Cleveland. I have a 34-year-old and a 30-year-old. My husband is a veteran. He had signed up through ROTC in college and continued to become a member of the Ohio Army National Guard. He now serves as the Assistant Director of the Cleveland Department of Veterans Affairs. I wanted to move back to Cleveland for several reasons. Professionally, I felt it was time for me to give back. I wanted to be able to end the rest of my career here back close to home. I had watched from behind the scenes the issues that had been ongoing. I had admired our mayor and felt his vision was phenomenal. What he intends to do or what he hopes to accomplish, whether it's for the citizens or for the employees and the environment and the culture, were all very much aligned with my own personal professional vision. So I applied. I was fortunate enough to get an opportunity to come in and interview, and then was offered the position. So I'm extremely excited to be here.
Thank you and welcome. We have approximately 15 minutes for quick questions and answers today. Then we'll hold a short executive session for considering your appointment. To my council colleagues, we'll each ask one question. If we have time, we'll ask a second round. So who wants to start? Go ahead, Councilor Cohen.
Yes, as you know from having some exposure to our city, culture in our workplace is something that we definitely want to improve and create not only a welcoming city for all, but a welcoming workplace. What are your thoughts on how you will start that process and continue that process in this role?
Absolutely. I think culture is the most important element in having a committed workforce. My thought would be to begin by meeting leaders and line staff. I'd like at some point to be able to meet with focus groups to understand from their standpoint, what are the pain points, what is working, what is not working. Based on that information, I'd like to compile a list of items that our employees are asking for, meet with the stakeholders, and come up with a plan of what can and can't be accomplished. Perhaps the most critical component in all of this is open, honest communication. If people are asking for something that we can't accomplish, I think I owe them an explanation of why and how. But most importantly, I want to create venues for people to express their thoughts, their opinions, to be heard, and to be able to help them feel valued. In my mind, simple things, basic things, walking around and talking to people, greeting them, understanding what is working within the schedule, within the shift, what is not working. That would be a start. At some point, it would be great to do an employee commitment survey to understand from employees what they feel and what they think, and based on that, come up with action plans that are driven by the employees and the leaders themselves.
Thank you.
Sure. You have a very impressive resume.
Thank you.
Thank you for wanting to come to work in Cleveland Heights. How much experience do you have working in a union environment? The majority of the city employees are union members here.
Yeah, I've worked with unions for 20 some years. At the current health system, we have 4 different union, bargaining union agreements. In fact, prior to this meeting, I was talking with April, and we talked about when are the contracts going to expire? So I'm very comfortable with that. I've sat as a chief negotiating officer. I have held management and labor relations monthly meetings. I have attended grievances. I have attended arbitrations. So I have a pretty solid comfort level with unions.
Thank you.
Councilor DeWitt Foy.
Thank you. First off, happy anniversary.
Thank you.
Thank you for spending it here with us tonight.
No.
I won't keep you too long. Your background looks primarily in healthcare and hospitals, and I'm wondering what, if any, challenges you foresee transitioning to municipal government.
Yeah, I think any new beginning presents challenges. While I will tell you, HR is HR no matter where you go. I have counseled physicians and I have counseled line staff. People issues are the same. I think if there is going to be a challenge, it's understanding the culture. It's understanding what motivates people in this kind of a setting and being able to relate to people. And I intend to remedy that by spending time with the people here, with the departments, attending meetings, asking to be invited so I can share with folks what my vision is, how we're going to help them in responding to their questions and their needs. And I intend to stay very close to members of the leadership team to seek their guidance. I think I will go in it with the mindset of I will be vulnerable, knowing that as a new person, there's a lot I don't know. So I will focus on building relationships with people so I can navigate my way.
Thank you.
President Kuda.
Hi, thank you. And Ms. Weber, I'm really glad that you're here today in front of us. This is a very big move for Cleveland Heights and a much needed move. We have a lot of employees, for over 400, and we need you in this position. I heard you talk about benefits and your experience with that. And I am deeply concerned about the cost of the benefits and how you might be able to help us. So if you could give us some insight into your background with benefits and how you think you would approach helping us save money with that.
Certainly. I mean, realistically speaking, the cost of benefits is escalating throughout the nation, as you very well know. Really, the highest cost of benefits is the pharmaceutical aspect of it. And there are things employers can do. And really, to begin with, I think for me, I would start by understanding the history. What have been the annual increases? What has been the wellness program? And how are the brokers advocating for the benefits? I will tell you, typically from my experience, the initial bids come in and you can expect the brokers to come back with a 20, 30% increase. But that's just not going to happen. So I will work very closely with the finance team to find out what the budget is. And then from there, I will hold the brokers accountable. I will also look at the plan tiering and the plan structure. There are things that, if done proactively, they will be very helpful in reducing some of the costs. For example, and again, not knowing what our benefits are, if you can encourage employees to do mail orders, 90-day supply for the same cost as 30 days, that's a great cost saving. It is also very convenient. If you can structure the plan so the first line when the employee goes to pick up a prescription is a generic versus the brand, great cost savings. These days, some manufacturers with high price tags for some medication, because they don't want people to do the generics, they will do an incentive so you get a rebate. Those rebates, I would hold, again, the brokers accountable to make sure that those rebates are applied to the plan. In addition to that, I think I would focus tremendously on a wellness program that addresses the chronic care conditions in the plan that cost the plan the most. When a healthcare plan is being renewed, 75% of the premium is based on the past 12-month experience, and then the remainder is on the previous 2 years' experience. If, for example, the city were to have, God forbid, a couple of really expensive situations, and they happen. If you have someone with cancer, if you have someone with, a transplant, those are very costly. Then as a cost measure, we can work with a healthcare provider, we can work with the brokers to laser those. So you buy additional insurance just on those high claims, so you can manage the rest of the claims and not have a pretty substantial increase. Having said that, I think our employees need to be aware of the costs that the city is paying for their benefits. Again, base pay salary is one component of the total rewards package. So if employees understand what the big picture looks like, I used to always do an employee, not a pay stub, but we would call it comprehensive statement, where they would see everything. They would see how much the organization has contributed to their tuition reimbursement, to their workers' comp insurance, and those things add up to the total rewards package. And that becomes another tool that helps improve the environment and also aid with retention. So while there is no magic bullet or, a quick solution, I do believe a comprehensive approach of all those different methods will absolutely make a tremendous impact.
Well, thank you for providing examples. I appreciate that.
Absolutely.
I'd like to know, Mayor Petras has often expressed his intentions to establish a practice of evaluating staff.
Yes.
So what first steps would you take to move towards having that necessary component built into our employment of all of our employees here in Cleveland Heights.
Absolutely. Having a structured performance appraisal process is critical. It is both legally helpful, and it's also a tool to help develop staff. It's a tool to help people become aware of their opportunities, as well as recognize their hard work. I would begin, and we had a brief conversation about this. There are extremely robust tools out there. I don't know that I think it makes sense to start with that. I would start with a simple process. I would begin by talking to the departments to understand if certain departments are doing something, what's working, what's not working. I would probably suggest a 1.5-page basic performance appraisal tool. I would initially suggest it's done once a year, but really best practice out there is it's done 2 times a year, mid-year and annual. And if you really want to be innovative, where I'm at now in the health system, we do one at 90 days at the end of the orientation or the introductory period. The objective is to be able to sit across the table from someone, have a face-to-face conversation. You could even have the employee do their own self-assessment and let's talk about the past 6 months or 12 months. Here are the areas I've seen you do extremely well in. Here are the areas that I have concerns. And by the way, let's focus on goals for next year. It is a collaborative effort, and you just simply can't go wrong with it. Prior to rolling anything out, I think it's just as critical to make sure that the leaders have training and they understand how to do it, and that HR acts as an advocate. We all know there are difficult employees, and there are folks that will challenge everything. So if a leader anticipates this is going to be a difficult conversation, I would absolutely offer to be part of the conversation. We would probably rehearse before, anticipate what might be some of the issues that come up, and be part of the conversation and help make sure the conversation stays on track.
Thank you very much. Anyone else have any questions? Councillor Cobb.
Sure. And this is sort of a follow-up to Councilmember DeWitt Foy's question. There are some specific nuances to public sector and civil service laws.
Yes.
Have you sat down and charted out how you're going to go about becoming familiar with those nuances?
Indeed. Just so you know, it's not on my resume, but I did attend law school. I am not licensed to practice in Ohio, just to be clear, but I have sat through law school classes. I am very familiar with the Ohio Administrative Code. I am very familiar with due process. I think I would initially lean on some of the HR staff, April, those folks that are experienced for procedural purposes. From that point on, I would take the time to understand, read, review, memorize, do whatever it takes to become familiar with them so they're second nature to me.
Okay. And I was just quickly looking, the Ohio Personnel Board of Review has a lot of great resources. Mm-hmm. And I would look to try and attend one of their seminars.
Agreed.
Or some other public entities' seminars on this.
Yeah, it's a great point. Yeah, okay. Absolutely.
President Kuda, anything? Okay. So nobody has any further questions. I do appreciate you coming today. We are going to go into executive session to discuss this appointment. And so
For clarification, would you like Dee to stay for that or no?
No.
That would depend on whether anyone has any questions they'd like to ask her in confidence or anything she wants to share with us in confidence. I don't either. President Kuda?
I don't have any of those kind of questions.
No, so we're good.
Okay.
Which is a good thing, right?
Yeah, absolutely.
All right, so I do need a motion to go into executive session.
I'd like to make a motion to go into executive session to consider and discuss the appointment of a public official.
Need a second?
Second.
Okay. Any discussion? Clerk Bassler, please call the roll.
Cobb,
Aye.
Larson,
Aye.
DeWitt Foy,
Yes.
Cohen,
Aye.
Kuda.
Aye.
All right. All right, we're back out of our executive session, and at this point in time, we're going to adjourn this special committee of the whole and move on to our regular committee of the whole in the other room. So thank you for watching.